Hello everyone, my name is Elizabeth Kuharski and I'll be discussing physician-assisted suicide today. Physician-assisted suicide, or PSA, has had a long history of criticism associated with it. It gives those that are suffering from terminally ill diseases the option to die with dignity, so to speak. A request must be made orally to the physician, who must wait a specific amount of time to ensure it's the patient's true wish. Then they may make a second oral request, as well as providing one in written form. PSA is not to be confused with euthanasia. With euthanasia, a doctor provides a lethal injection that causes death in the patient. With PSA, prescribed pills are given to the patient. This allows them to have the choice of when they die, or even the choice to back out if they so choose. It provides them the freedom to have their death be swift and to not wither away with pain and suffering. Through the Death with Dignity Act of 1997, Oregon became the first state to allow terminal residents to choose to self-administer the lethal prescription. Other states have followed behind. California, Colorado, Washington, D.C., Vermont, and Washington State all now allow death via PSA. Montana allows for it as well, but only through a Supreme Court ruling. Through Richard T. Schaefer's writings, sociology is broken down into various perspectives. One I feel that pairs well with PSA is the functionalist perspective. Its focus resides upon a broader sense of society. How far will this one act spread? Will it benefit the stability of the society? This perspective is perhaps why PSA has not had a more welcoming reception. Many religions view suicide as highly immoral and unethical. If more states allow for it as society becomes more progressive, more people would be considered sinful in a sense. PSA has had issues to this, with morals being brought into question. On the other hand, an interactionist perspective is a little smaller. This has greater focus on personal interactions and how things may relate on a day-to-day basis. Instead of focusing on how this would affect the entire society, ask instead how it would affect a smaller group, such as the family. They've already been dealt a terrible blow of having their loved one acquire a terminal illness. Through PSA in this perspective, the personal relationships are considered. The patient doesn't want to burden the family and have them watch as the patient grows sicker and more fragile. Instead, the patient chooses to have the family remember as they once were, happy and not living in excruciating pain. Essentially, sociology matters in regards to physician-assisted suicide for a few reasons. A sick role, as defined by Schaefer, is a societal expectation about the attitude and behavior of a person being viewed as ill. Often society expects a terminally ill patient to join hospice and live the rest of their days out, being cared for and surrounded by family until they fade away. Allowing someone to decide to pull their own plug, so to speak, is ludicrous to many. However, why should we let someone suffer if they're willing to die in a painless way? As society progresses and states allow for PSA, medical professionals must follow a certain code of ethics when handling such a delicate topic. These standards of behavior must be present at all times to ensure the patient's last days are comfortable. Without this code, professionals would be able to berate the patients and deny them the request of the PSA just because the physician finds it unethical. By allowing PSA, patients can have a greater overall sense of health, as health is much more than physical well-being. Choosing to die without suffering gives them a sense of dignity and mental state of peace. They don't have to fear the pain of death and becoming a shell. They choose to die, not letting their disease take their life. Though their physical health suffers, the other aspects of health may flourish in a bleak time. In conclusion, people shouldn't be made to suffer prior to death just because someone else finds it unethical. This is important to me as I hope to join the medical world after graduation. Medical professionals are often criticized for making unpopular decisions, though it's often not by their choice. They make choices with their patients' best interests in mind, hoping to create a better society. In the end, you should always try to be considerate and empathetic of others. You never know what they're going through. They could be a doctor being criticized by media for letting someone have their final wish. Perhaps their family member who just lost a loved one. Being open-minded and considerate of another person's situation can lead to a greater society as a whole.